Welcome to the Tide Dashboard Quick Start Guide. In this video, we'll walk through how to access, navigate, and use the Tide Dashboard to support population-level CGM review. This is a practical orientation meant to help you understand how the dashboard is structured, how data are organized, and how teams typically use Tide to identify and prioritize patients for next steps. The Tide Dashboard is a population health analytics tool designed to support diabetes care teams. It helps teams identify, segment, and prioritize people with type 1 diabetes based on CGM-derived patterns of glycemic risk. Rather than focusing on a single patient at a time, Tide is built to support population-level review, so teams can see where risk is emerging and decide where to focus attention first. The Tide framework stands for Timely Interventions for Diabetes Excellence. It was originally developed at Stanford Medicine and has since been adapted by the Rising T1DE Alliance for use across a wide range of clinical settings. The RTA implementation is built in Microsoft Power BI and uses CGM data processed through the RTA Diabetes Data Doc. This allows for consistent, standardized population-level review across participating sites. At its core, the Tide dashboard helps teams answer three key questions. First, who may need attention right now? Second, what type of CGM-related risk is present? And third, where should the team focus first, given available capacity? The dashboard is designed to make these questions easier to answer quickly and consistently. The Tide dashboard is delivered through Microsoft Power BI and is available only to authorized users at participating sites. To access the dashboard, you'll need an institutional Microsoft account with Power BI access enabled, along with authorization from your site or program lead. There are two common ways to open the Tide dashboard. You can log in to Microsoft 365, open Power BI, and then navigate to the Tide dashboard workspace. Or you may receive a secure Power BI link directly from your site or program lead. If you're unable to access the dashboard, your site lead or designated support contact can help troubleshoot. One of the most important concepts to understand in Tide is the patient week. Each row in the dashboard represents one patient and 1 week of CGM data. This structure allows teams to review patterns over time while still prioritizing recent or high-risk data points. The patient table supports column-based sorting, which allows you to reorder patients based on selected metrics or contextual fields. It's important to note that sorting only affects how data are displayed. Sorting does not change which patients are included or how risk categories are assigned. It's simply a tool to support efficient review. CGM risk categories are the primary way Tide organizes and prioritizes patient weeks. Each patient week is assigned a single risk category based on predefined CGM-derived patterns. These categories are ranked by priority, with lower numbers indicating higher priority for review. Risk categories are designed to support prioritization, not replace clinical judgment. They help teams quickly understand where risk may be concentrated across a population, while still leaving room for clinical context and team-based decision-making. The Tide dashboard uses visual cues to support quick scanning and interpretation. A green dot indicates that a value is within the expected range. A yellow dot signals that a value is nearing a risk threshold and may warrant closer review. A red flag highlights that a patient week meets an additional risk criterion beyond the assigned risk category. Red flags do not change the assigned risk category. A single patient week may display multiple red flags, even though it is assigned to only one risk category. These visual cues are meant to be signals, not conclusions, and should always be interpreted alongside clinical judgment. Most teams use Tide in a consistent workflow. First, a population is selected using the CGM Risk Categories and Population Selection page. Next, teams review the distribution of CGM risk. From there, the population is narrowed to a focused cohort using the detailed data page. Patients are prioritized, and then teams move to next steps outside of Tide using downstream tools. The Tide dashboard is organized into a small number of pages, each designed to support a specific stage of population-level review. All pages can be accessed using the left-side navigation panel in Power BI by selecting the page title. The landing page provides orientation, definitions, and entry points into the dashboard. It's a helpful place to start if you're new to Tide or need a quick refresher on key concepts. The CGM Risk Categories and Population Selection page is the primary population health view in Tide. Teams use this page to apply filters, review CGM risk categories, and define the population they want to focus on. The detailed CGM and recent visit data page displays tabular summaries for the currently selected population. It brings together CGM metrics and recent visit context to support patient-level comparison and prioritization. The individual history page provides longitudinal CGM context for a single patient. It's often used after population-level identification to support intake, triage, or deeper review. The A1C over 9 page highlights patients with persistently elevated A1C values. This view supports identification and prioritization of individuals who may benefit from focused follow-up or intervention. Population segmentation happens on the CGM Risk Categories and Population Selection page. This process helps teams move from a broad population view to a more focused cohort. Teams typically start by reviewing the full CGM population and clearing any existing filters if needed. Filters such as age, visit recency, CGM data availability, or provider can then be applied. It's best to start broad and narrow gradually, reviewing the distribution of risk categories along the way. Once filters are applied and the risk distribution is reviewed, selecting the blue button allows you to proceed to patient-level review. This transitions you from the population segmentation page to the detailed data review page. Patient-level review takes place on the detailed CGM and recent visit data page. This page helps teams see which patients make up the selected cohort, compare patients, and decide where to focus first when capacity is limited. When reviewing the table, teams often look for combinations of risk signals, recent changes in time and range, low CGM wear time, missing data, and visit recency. The goal is to create a focused, manageable list of patients for next steps. The individual history page allows teams to review CGM trends over time for a specific patient. It helps determine whether recent risk signals reflect isolated events or ongoing patterns, and whether CGM engagement has changed. A few best practices can help avoid confusion when using Tide. Start broad, then narrow in. Be aware that filters may persist from prior sessions. Remember that sorting does not change which patients are included, and focus on patterns rather than single metrics. The Tide dashboard supports identification and prioritization, but action typically happens outside of Tide. Common next steps include intake or triage discussions, outreach, care coordination, and intervention selection. Teams often use tools such as the Intervention Analytics Dashboard, REDCap, or site-specific workflows to support these steps. The RTA Tide dashboard helps teams move from CGM data to prioritized patients, quickly, consistently, and transparently. Regular use supports shared understanding and helps teams recognize meaningful change more efficiently. To get started, log in through Power BI using your institutional Microsoft account. Begin by applying filters and reviewing CGM risk categories to segment your population. From there, review patient details, identify priorities, and move confidently to next steps as part of your team-based workflow. For more detailed instructions, definitions, and examples, be sure to reference the full Tide Dashboard User Guide. The guide provides deeper context and can be used alongside this video as a practical ongoing resource. You have now reached the end of the RTA Tide Dashboard Quick Start video. For questions, feedback, or support, email us anytime using info@risingtidealliance.org or visit our website risingtidealliance.org. Thank you.